Good evening, everyone. I am Dr. Tarnisha Hemphill, Assistant Professor here at George Washington in the School of Nursing Midwifery Program, and I am also a certified nurse midwife. Thank you for joining us for this important conversation during Black Maternal Health Week with a focus on birth equity and joy in care. So, I want to start by grounding us in truth. In the United States, Black women are still 2 to 3 times more likely to die from pregnancy related causes than white women. Black and brown pregnant individuals also experience higher rates of preterm birth, cesarean birth, and severe maternal morbidity. These disparities persist regardless of income, education, or access. And yet here we are. As midwives, we don't turn away from these statistics. We lean in. We show up. We build relationships. We create spaces where patients feel seen, heard, and valued. Because the story is not just about disparity, it's also about possibility. It's about how we restore trust, how we center dignity, and how we create joy in the pregnancy journey, even in the midst of systemic challenges. Today, we're going to explore one powerful model that is doing just that: group prenatal care, more specifically, centering pregnancy. A model that doesn't just provide care, it builds community, connection, and confidence. And I am so excited to have Kia Hollis here with us this evening to share her expertise and experience. Kia Hollis is a certified nurse midwife and director of the Centering Program in a practice in Baltimore City, Maryland. Hello, Kia. I am so happy to have you with us this evening.
Hi, and thank you for inviting me. I'm happy as well.
Great. So let's start with the foundation. Can you share with us what is centering pregnancy? For those who
Abs-
may be new to this model, what does it look like in practice?
Absolutely. So, hi, everyone. Thank you so much for joining in this beautiful discussion. Dr. Hemphill, thank you for putting it on. Black maternal health care is something that, we should continue the discussion on to continue to reduce the disparities. So, centering pregnancy is actually a national model developed by Centering Healthcare Institute. This model was actually established by a midwife, and it combines medical checkups, education, peer support in a group setting rather than a traditional one on one. And so these visits are with small group of pregnant women who are generally due around the same time gestationally. Each session lasts for about an hour and a half to 2 hours. Basic health checks are done by the patient, so blood pressures and weight. Guided discussions around pregnancy, birth, breastfeeding happen. Time to share experiences and ask questions, and is often facilitated by a midwife, a provider. So it differs from traditional one on one because the structure and time is longer. The learning style is more interactive and facilitated. There's a social support group that's developed because the patients are grouped together, and it facilitates engagement.
So I always like to say the pregnant women get to watch each other's bellies grow together. And they
Yeah,
always are like, yeah,
absolutely.
they love
Hmm.
that. And I believe we have some pictures that we can show to kind of illustrate what you're saying.
Hmm.
Can you talk us through some of these pictures that's on the screen?
Absolutely. And so the first picture is the belly checks that are done. And so a lot of times patients are like, well, when we first introduce them to the model, they're like, well, do I still get that one on time with my midwife? What happens if I have a question that I don't want to bring up in group? And so they still get one on one time with the midwife. And we go over labs, we go over orders that need to be done, and then we have time to listen to babies. And so just like Dr. Hemphill said, it's great to see bellies grow, but it's also great for patients to hear other babies in the belly and say, oh, that's a healthy heartbeat. So centering pregnancy is also interactive. And one of the pictures is just part of that interaction. And so this is where we work on our labor and birthing positions. And so a father is helping a mother get through one of the different positions. And so with centering, you don't always have to lay in your back when giving birth. Sometimes you can do it standing. Even if you have the epidural, there's a way for the bed to kind of mold and fit to allow a squatted position. And so the father is helping the mother through that. Interactive. So we have a true and false game that kind of helps disprove myths that are heard within the community that patients bring up themselves. And then we also have a cooking demo as well, because a big component for centering is nutrition. And then we have breastfeeding as well. And so all of these are components that pregnant women want to know about as it relates to what happens after the baby comes, right? And so walking mothers through breastfeeding, we have our beautiful lactation consultants that usually join us. And so the first time the patient will see the lactation consultant is not on labor and delivery, but actually at the centering class.
So, what led your practice to choose centering pregnancy as a model of care, especially when thinking about the needs of Black and Brown patients?
Good question. So, centering pregnancy was intentionally designed to be engaging, hands on, and also very memorable. So, we recognize that adult learners learn best when they're actively involved in their care and they incorporate creative, interactive activities. And so, for us, what led Mercy to kind of implement the nursing care model is that we realized that patients needed more than the traditional one-on-one visit. And so we realized that yes, we could do a clinical assessment in the traditional one-on-one visit. However, patients needed more. There was a limited time, relationship building needed to happen, and we also needed to start addressing the emotional and social aspects of pregnancy. So developing this model allowed us to kind of move beyond the constraints of the brief one-on-one appointments and create a safe space where patients could actively participate in their care.
I love that. Yes. Black Maternal Health Week focuses on birth equity. Now, unfortunately, there are many barriers that Black and Brown women face in obtaining and receiving prenatal care. How does your centering program help address barriers like transportation, food insecurity, childcare, or even mental health needs?
So, structural barriers that disproportionately impact Black and Brown care are continually present, right? Gas prices are
Mhm.
increasing, and so
Absolutely.
gas
Yes.
is expensive. And so, the patients in this population, one, might not have a car. And if they do have a car, gas is getting expensive. Or it takes them 3 or 4 bus trips to kind of present for a place of care. And so centering has facilitated this need by providing transportation, not only to the centering appointments, but if patients also need a physician appointment in the middle, or if they need ultrasound appointment, or if they need a genetic consult, then we provide transportation, round trip transportation for patients. We also, if they have a car, then we also facilitate so their parking is waived. Their parking fee is waived. In regards to nutrition, so nutrition is a big thing in the city of Baltimore as well. A lot of places in Baltimore are a food desert. And so, because they're a food desert, we also provide fresh produce and fruit as well for patients throughout 4 weeks of the centering program. And it's interesting because one of the patients at the beginning, when she received her box, she was like, well, I've never seen this green vegetable before. And it was a zucchini. And so, knowing that, we also found a need to integrate recipes as well, so that patients, for the first time, if they've seen a zucchini for the first time or a squash for the first time, we also provided creative ways on how they can integrate it in their diet. um Childcare is also a barrier, and so we, if mothers don't have any other option, then we provide a safe space for them to bring their child, and the facilitators kind of work together to help watch the child and keep the child active so that mothers can learn. Mental health is also needed, but not only needed, but specifically in the Black and Brown community, there's a stigma around getting mental health. There's a stigma around depression, at least in my family specifically. The aunt is never deemed crazy. She's just or never depressed, but she's just like labeled as crazy. And so we try to break down that barrier by having a social worker who is sound and credentialed in maternal mental health. And not only does she facilitate the session around depression, but she also helps like work mothers through signs and symptoms that might occur so that they could have early recognition.
Yes, thank you for that. These services are so important. Patients really want to receive prenatal care, but are burdened with deciding between purchasing food or transportation to their prenatal visit. So, providing these services reduces or even eliminates that burden, and in turn provides patients with joy by enabling them to seek prenatal care. Out of those services, which services do your patients like the most?
They love the transportation. So savings on gas, savings on the stress of driving through the city,
Mhm.
and the settings of traffic that could happen, construction that also happens. And then a new find that they're starting to love is the men's group. And so we've also seen a need to kind of establish a men's group as to allow our fathers to know that they are important too. And not only are the mothers the foundation of the family, but fathers are too. And so a lot of fathers are having great reception to the men's group that we've established, and a lot of fathers are finally feeling like they're being heard.
Yes, absolutely. I really love that because we want patients to feel supported, but sometimes the support people don't know how to support. So the fact that you
Mhm.
have that men's group, I think that is great, and you're really connecting, and it's about the community, not just about the patient. What services do you feel have the most impact?
I personally feel like the mental health and the food boxes that we do for the 4 weeks has the most impact. I've heard positive stories as it relates to the food boxes, and mothers recognizing, like, oh, I've never seen this vegetable before, or I've never read a label, a sugar
Mm.
label, or a salt label in this way. And now instead of picking the Skittles that have like 50 grams of additional sugar, I've been able to do like dried mango, which has additional sugar, but not as much, and a healthier snack. Or instead of picking the cup of noodles, I've learned to do kale in the oven and sprinkle a little bit of sea salt. And so those ways not only target obesity, which can increase the propensity for preeclampsia, gestational diabetes, babies that are born larger. But it also has postpartum impact as well as impact outside of pregnancy when you learn more creative and healthier ways to prepare your food.
Yes. And I feel like there's also, I've noticed a cultural component to it as well. So when they're providing information about nutrition, they're looking at the patient population and the types of foods that Black and Brown people really like to engage in and showing them other ways to still enjoy that flavorful food, but finding ways to
Mhm.
maybe cut back on maybe not so much salt, but still
Mhm.
keeping the flavor. And so I really like
Mhm.
how there's a focus to that cultural aspect.
Yeah, and so another example of that, instead of using seasoned salt or the garlic powder that I traditionally have used in my household, I find that using garlic and onion, is a healthier alternative, as well as, instead of picking up like juice or soda, like coconut water. And if we don't like coconut water, we can add berries to our coconut water or lime to our coconut water. So there's definitely a cultural component. The oodles of noodles are always a sensitive
Yes.
topic when it comes up. And patients see the sodium content and they're like, well, I love oodles of noodles.
Yes.
And it's not to say that you shouldn't, but here's a healthier alternative.
Yes. So, I mentioned that midwives create spaces where patients feel seen and heard and valued. How does centering support patient empowerment and shared decision making?
Yeah. So centering is once again essentially designed to help address long-standing disparities. And so not only do patients feel inclusive, but we are also very intentional about like being culturally responsive. And so in this is reflected by the moment patients walk in the room. And so the moments they walk in the room, one, they hear Afro beats or Sade playing. I don't know if I'm dating myself saying Sade.
Maybe a
But they
little.
hear, right. They hear Afro beats or Sade or something else that's culturally appropriate when they walk into the room. They also see pictures of Black and brown bodies as it relates to if the session is breastfeeding posters of a Black brown body, and then if the social is labor or birthing, they see Black brown faces with labor and birthing. And I think inclusion is very, very missed in the medical field, like just in general. If you look at a medical book and you look at
Mhm.
eczema, there's always a comparison of Caucasian, but there's no
Mhm.
comparison of how that might look different in the African American population. And so just feeling included or being seen, that also creates a safe space when you're walking into a more neutral environment. The other thing is we try not to make it as sterile as a medical room. And so by doing that, we try to incorporate colors and resources and different textures. And part of the layout for centering is actually in a circle. And so being in a circle, there's no leader. And so although medical professionals like midwives are in the room, there's no head, there's no tail. And so that always limits or puts everybody on the same playing field. Um, Other things that are more important are the providers at our clinical practice actually reflect the patient population. And that research has been backed by that as relates to when patients receive care from providers that look similar to them, it can improve not only communication, but trust and health outcomes.
You spoke Dr. Orridge's love language because that is a pet peeve of hers, that word sterile. Having the
Mm-hmm,
environment where patients come to that looks welcoming and
mm-hmm,
inviting and not so hospital and medical. So I
mm-hmm,
know that she was smiling and shaking her head as soon as you said that.
mm-hmm, mm-hmm,
Now, we just shift gears a little bit because you said something about outcomes. So, from
mm-hmm.
a community perspective, understanding that improving maternal and neonatal outcomes is not only important for the pregnant patient, but also for her community. So, how does creating community among Black and Brown pregnant patients using the centering model contribute to improving outcomes, healing, and resilience as a result of these alarming statistics?
Great question. So, specifically at our hospital, we've done the research and we've shown that patients receiving traditional hospital based care versus participation in the centering model really has been associated with reduced rates of preterm labor, reduced rates of cesarean delivery. It's lowered the incidence of low birth weight babies as well as has led with higher rates of breastfeeding and compliance into the postpartum journey. And we really believe that empowerment through active participation in health monitoring helps facilitate those outcomes. And so patients often in the centering model are tracking their own weight, they're tracking their own blood pressure, they're tracking their own health indicators. And so part of this engagement allows the patient to realize, oh, my blood pressure is a little bit higher today. I wonder why. And do some self reflection on why. And so, is it because I ate a salt enriched meal? Or is it because I'm more sedentary? Or is it something called preeclampsia or gestational hypertension, which we talked about in centering, that has nothing to do with me, but has to do with my baby, the placenta, and should I get this evaluated sooner? And so the hands-on approach increases health literacy, and it also helps patients feel more comfortable and more connected to their bodies. It reinforces a sense of their ownership, and it allows them to present for care for early intervention. It also allows them to have a voice to say, oh, this is abnormal. How do I fix it? Or what needs to be done to correct it? And so we really have seen very positive outcomes since the inception of centering in 2022, and those health outcomes have maintained.
Great. That's very impressive. And this is one of the reasons why you do the work, right?
Mm-hmm. Mm-hmm.
Uh, So, in a time where many Black and Brown patients may feel fear or mistrust in the healthcare system, how does centering pregnancy help patients feel more comfortable, supported, and safe throughout their pregnancy journey? In other words, how do you help them find joy during their pregnancy journey?
Great question. So I feel like this model naturally just follows or fosters both patient empowerment as well as shared decision making, by creating an environment where knowledge is not only engaging, however, you're building confidence around the knowledge that you're learning, and you're also collaborating, which also inspires joy, right? So the group model strengthens one's voice, it strengthens their confidence, which leads to joy. It's provided, the group model is also provided in a supportive, non judgmental space. Patients are encouraged to speak up, ask questions, share preferences. I know in some of our group, TikTok is always brought up. So, oh, what I learned in TikTok University.
Yes.
And so some physicians or providers in a one-on-one setting might be like, oh, who cares about TikTok? However, in the centering group, it allows you to have a conversation around it so that a patient isn't shamed for having that idea or having that thought, but it allows to give voice to that concern. And it allows them to validate that concern, which then in of itself reinforces the need to learn, the need to speak up for yourself, as well as you can have joy in your pregnancy. Um, Also the continuity of care and the relationship building that they have with the same group of women, the same partners, and the same facilitator or midwife also fosters joy as well, because this provider is now familiar with you as a person. They're familiar with your story. They're familiar with your health history as well. And so there's not only that, provider guidance, but it's also a mutual dialogue and like, oh, I've seen you throughout your whole journey. I noticed that your blood pressure is high. And the patient's like, oh, I've noticed that too. And that facilitates comfort and joy as well.
Yes. Now, as a midwife providing this model of care, what have you learned either about the patients, your practice, or even yourself?
Good question. So, I myself have learned that healthcare extends far beyond a diagnosis as well as clinical management. I feel like in nursing school, for physicians and medical school, I feel like it's easy, very, very easy to kind of get a health history, work out your differential, focus on your differential, and then come up with a diagnosis, a treatment, and a plan. And when you're actually like in the field, models like the centering model kind of takes you away from the differential, the diagnosis, the treatment, and the plan. You're still in it. However, that extended period of time allows you to realize that each patient truly does carry their own unique story. And our role as a provider is not only to guide them through a vulnerable time, such as pregnancy, but also to serve as an advocate and a trusted voice in their care. This model has helped me realize the need to reinforce the importance of seeing the whole person and not just their pregnancy.
Mhm.
So, for instance, if a person, one of my patients, right, they came into me and I realized her mood was different, like different from her whole pregnancy. She was 37 weeks, different from her whole pregnancy, but her blood pressures were also elevated. In that simple conversation, I found out that her brother was unfortunately murdered, and there was more things going on that were socially impacting her blood pressure.
Mhm.
um, she was still seen in the ER to rule out preeclampsia and gestational hypertension, but me as a provider, I could provide a stronger voice on, yes, her blood pressure is elevated, but let's look at this. Let's do a further evaluation to take home blood pressures if she's ruled out to have preeclampsia or gestational hypertension. And then with the comparison of home blood pressures, we know that this is just stress induced. And so knowing the patient, knowing that the care and story goes beyond just a clinical diagnosis is what I've really learned. I've also learned and have found joy in caring for patients that reflects my own identity, because there's just a deeper level of understanding. When I see a face that looks like mine, there's unspoken recognition of shared experiences. So like, oh, how many microaggressions did this patient go through today? How many
Mhm.
like
Yes.
life stressors? In the way we are perceived in environment looks a lot different. And so knowing that a patient can truly and authentically be themselves as when they
Mhm.
show up in this model, and that in and of itself brings me joy, because I'm like, you don't
Mhm.
have to put on a front. Like, this is
Mhm.
me. I'm a
Mhm.
provider, but you can be your real authentic self. And that shared understanding allows me to approach my patient with a greater empathy and grace, as well as create a space where they feel seen, heard, and supported. And in turn has strengthened both my practice and my sense of purpose as a midwife.
Yeah, I love the stories that you shared, especially about how a patient can present with high blood pressure, and sometimes people would just stop there,
Mm-hmm.
and not dig into maybe there's something contributing to that. Maybe there
Mm-hmm.
are other stressors, especially if it's an isolated elevated blood pressure. So
Mm-hmm.
having that conversation with them, saying that, I hear you, I see you, but just so we do our due diligence, still go over to be evaluated. Patients are more willing to do that when you kind of talk through and kind of help them understand that maybe this is blood pressure,
Mm-hmm.
stress related, or maybe it's not. And I feel
Mm-hmm.
like we want that follow through. And sometimes
Mm-hmm.
patients don't follow through when they feel like you are not hearing them or you see them just as a diagnosis. So I just really
Yeah.
appreciated that example.
Absolutely. And then in addition to that, I also think, when you know the patient, you can also present care in a different way. And so you can still, for example, you can still inform patients about potential complications for preeclampsia, but maybe instead of not leading with stroke, death, stillborn, you
Yes,
can you can
yes.
do it in a softer way, where a patient can be more receptive, but you can still integrate stroke,
Mhm.
death, stillborn, but in a softer way, where a patient can actually hear and be receptive to it.
Absolutely. I agree. So Black Maternal Health Week, I mentioned, is talking about birth equity, but they're also focusing on joy, which we started talking a little bit about. And I'm glad we're talking about it because we don't talk about it enough. And we don't talk
Mhm.
enough about the joy as us providers feel when we're providing care to our patients. So I like that you touched on that. How do you find joy in providing this model as far as it being reflected from your patients? So your
Mm-hmm.
patient's joy in this model.
Mm-hmm. So I find joy in being relatable, being authentic. I recognize that there is only one version of myself, and my lived experience allows me to connect with my patients in my own unique way. I'm also able to show up not just as a provider, but I'm also able to show up in a way to offer care as if the patient were my sister or my aunt.
Mhm,
And so that's through a different lens, a lens that is guided with compassion, honesty, and also intention. And that joy is often reflected back to me through my patients by trust. And
mhm,
so a lot of communications around trust as it relates to Kia, for example, just last week, their patient was seeing me for a postpartum visit. However, she brought her newborn and she was like, Kia, I trust you, but can you just look at my newborn's umbilical cord real quick and tell me if, and I'm like, honey, I'm gonna lead by saying I'm not a pediatrician.
mhm,
However, it does
mhm,
not look infected, but you should still follow up with your pediatrician. But that would also be a patient who would not have followed up with their pediatrician. And so just hearing from a trusted source, yes, I'm concerned or I'm not concerned, you should follow up, made her reflect and be like, okay, well, I should follow up. Let me follow up. So trust is not taken lightly. And so when patients say that they trust you, they respect you
mhm,
as a provider, that really deepens like joy and
mhm,
affirms that I am in the place where I need to be as it
mhm,
relates to delivering care. I also find joy in patients not just conveying trust, but also being willing to share about their stories. And then in comfort, they express during our time and during a vulnerable time. Pregnancy can be very isolating and it can be very vulnerable for anybody, right? And so knowing that you are looked at as a trusted provider during this time instills so much joy. And that mutual exchange of trust and understanding is what makes this work deeply fulfilling.
Yes, yes. I know in my experience with centering pregnancy, I found joy in watching that shy, introverted patient with no support system develop a sisterhood. And that's a word that we use a lot of times in centering pregnancy, developing that sisterhood among other members in the group. And I've had a patient tell me that, she looks forward to coming to her visits and how she wished there were more centering sessions. And so just hearing that and knowing that sometimes there is those barriers to getting prenatal care and knowing that coming to centering and feeling heard and seen and just having fun is a pulling force. It really helps with that motivation piece that we kind of struggle with in people receiving care. And so I feel like
Mhm.
centering kind of answers that. And for me, that brings me a lot of joy in getting that feedback and patients wanting to be here.
Mhm.
So other moments might remind you of why this works or matters? Any other patient testimonies or patient encounters that you can share with the group?
Absolutely. So, towards the end of a patient's pregnancy, and when she fulfilled like all the centering classes, she was just very inspired, encouraged, and empowered because she was a patient who expressed to me that she wasn't going to show up for any of her prenatal care visits. She was just going to show up for the three that mattered in her
Hmm.
eyes, which was the third trimester and term to discuss her induction. However, the reason why she expressed that she wasn't going to show up is because she told me a story about her 2 year old and how she had to present to three different ED visits because her 2 year old had swallowed a penny. And she expressed this to providers, but none of the providers were listening that this 2 year old swallowed a penny, and the 2 year old would have gotten additional imaging and procedure would have been done to remove the penny sooner than the fourth ED that she showed up to that actually listened to her and did the correct imaging and did the correct process. And she said that was just a glaring example of how I'm not being heard, so what's the point of being seen for my prenatal visits or showing up for my prenatal visits. However, she reinforced that like the centering model, one, allowed her to get out all the myths that she heard, allowed her to get out a better understanding, reinforced normal versus abnormal in a way that she could advocate for herself. And so now she knows how to advocate not only for her 2 year old, not only for herself, but also for family or friends. And so that's what really um, deepens my desire to continue this model,
Mhm.
because it is changing. It's changing the way patients are not only seeing themselves, but being connected to normal versus abnormal and knowing when they need to present to care.
Yeah, thank you for those examples. I realize we have some other pictures that we can show. If you can kind of talk us through, once
Mm-hmm.
again, to illustrate a little bit more.
Yeah, so these are our community resources. And so this is the picture right here in regards to resources are just examples of providing different tools. And so, you know, when we really talk about an inclusive space, you see a book as it relates to affirmations for Black women. Just because 94% of our population that we see at our practice are Medicaid, and 97% are African Americans. We also believe not only in empowering yourself through education, but also mental health is very, very important. And so there are additional resources that are provided as it relates to finding your balance. We have a whole mental health session, as discussed earlier, not only with a social worker, but we also have another mental health session that walks through sound bowls as well as a guided meditation so that patients develop their own toolbox so that when they encounter stress, they can pull out these tools that they've learned from the toolbox, hopefully, that will help mitigate or manage stress a lot better. And then this is an example, the Hungry Harvest or the middle box is essentially an example of the produce boxes that are given out for 4 weeks of our program. Nutrition is very, very important in pregnancy. And so not only do we do the food boxes, but we also have a whole cooking demo. And
Mhm.
so the cooking demo is also targeted for Black and Brown populations because it allows us to figure out how we can use our own recipes a little bit better, or maximize the use out of our recipes. And so the cooking demo can go through things like, oh, a trail mix bar, or how do I make this like frittata or egg roll more nutrient dense and protein rich. And then transportation, so the infamous service that everybody loves. And so we do provide Uber rides as well.
And those Uber rides is not just to the prenatal visits, right?
Right. And so it's also to ultrasound or sonography visits. As stated before, the centering program is led by midwives. And so we're a higher risk practice. And so if those patients need to be seen by physicians as well, they can get transportation for the physician visits as well. This is another example of just interaction. And so some people, like people in general, learn through auditory, so listening. Some people learn by kinetic movement. I know I'm one of the visual learners as well as kinetic movement. And so we incorporate different learning styles in centering as well. And so this is our second to last class, which facilitates the obstacle course. And so the first component is swaddling. And so, how do you swaddle a baby in a blanket? And so, we know that you can buy one of those like swaddlers. But for people who don't have extra money to buy a swaddler, how can you just do it with a regular blanket? And so, this is a safe, healthy way to swaddle a baby. This obstacle course also shows or test patients on different breastfeeding positions. And so for our lactation class, women learn the difference between a football hold versus a cross cradle hold, and what does that difference kind of look like. And so after the swaddling station, the breastfeeding position changes station happens. And then after that, how to make a bottle, and then how to place the baby in a car seat. And the car seat demo is led by one of our OB navigators who actually has trained in car seat safety. And so the partners are encouraged to participate too. And this is a fun session that gains a lot of interest because it's interactive and healthy competition.
About to say, and a little bit competitive.
Yes.
And we become a little strict because they want to lay the baby down on the table when they make the bottle. And we're like, no, no, no. You got
Right.
to hold the baby and still make that bottle. And they're like, you're right, you're right. And
Yeah.
so they have a lot of fun with that.
Yes. And then this also, ties into the mental health component. And so we open with an opener, right? And that also makes the appointment less sterile. And so the opener helps join the group on one accord. But, affirmations are very, very important as we look at a lot of aspects of life, speaking over oneself, giving yourself a positive affirmation. Because if you're not going to do it, you might not have that coming from other ways. And so affirmations is just another tool that we can put in our toolbox so that we can pull out on those low days or on those gray days. And so our closing affirmation is the mothers putting their hands on their bellies and the partners also putting their hand on their partner's belly and just saying, I love myself, I love my body, I will be well, baby will be well. And so, the mind is a powerful thing. And so, a lot of times the mind gets to us. And so, always closing with a positive affirmation helps ground us in that moment, and look forward to hopefully a healthy, positive outcome in baby. The reunion is a big thing as well. And so the reunion was actually a patient idea as it relates to mothers that go together in the cohort. They want to see their babies at the end. And so after the last mother in the cohort has delivered, everybody is asked to come back, and we have food, we have desserts, and I look at it as a sip and see. A sip meaning like sip on some soda or some water, and then see your babies, be able to share your birth story, able to share kind of the struggles that you've had as a parent. And the hope is that sharing the struggles will also help other parents realize, one, that they're not alone, or it can also help in the fact that, oh, like, well, this worked for me, you should try this. And so helping to learn other strategies amongst yourself to find different resolutions. And then this is just a picture of what brings me joy as well.
Yes.
And so these aren't all the patients that we've helped with the centering model, but these are some of the patients. But seeing all of the faces, the father being engaged in the lower right with bottle making, it just really brings me joy to see the smiles that are on everybody's faces, the babies that might be sleeping, might be crying. However, facilitating and fostering community, where people are able to kind of speak on their own behalf and they're actually happy to walk through their journey of pregnancy.
So, in closing, as we think about birth equity, it's not just about reducing disparities, it's about reimagining care. Care that is rooted in community, cultural humility, shared decision making, and yes, even joy. Centering pregnancy reminds us that when we bring people together, when we listen, when we honor lived experiences, we don't just improve outcomes, we transform the entire pregnancy journey. Thank you so much for sharing your wisdom and your heart with us today.